My name is Dr. Daisy Odundo. I'm a pediatrician, stroke pediatric nephrologist in Kenyatta National Hospital. And today we have the pleasure of my colleague, Dr. Robert Kemboi, who is a clinical nutritionist and works with us in the pediatric wards. And today he's going to take us through a very crucial thing and it's most of the questions that we tend to be asked by mothers on complementary feeding. And also he'll give us examples, and it would be good just to hear his experience on what we need to do, what we ought to do, and maybe to curb malnutrition. So without further ado, Kemboi, we can proceed.
I think you are giving me the title. I'm going for it.
Let me start. Yeah, you can see?
Yes. So I proceed?
Okay. Yes.
Okay. Okay. Thank you, Daktari, for that introduction, and also for this today's topic on complementary feeding. I've actually decided to do optimal complementary feeding after 180 days of life. This is after 6 months of exclusive breastfeeding. And we are going to dwell so much on complementary feeding. And those are my titles there. If anyone wants to contact me, those are my credentials and the contacts number. So am I audible enough?
Yes, I think you're okay. I think it's my internet.
Okay, thank you. And we are saying at the first beginning is that we are saying a diverse introduction of diverse foods during infancy. That's now at the right time. That is after 180 days. That is 6 months. Might have protection on asthma and food allergies and immune regulation. So this early introduction or introduction of complementary feeds at the right age would help the child prevent it from asthmatic, some food allergies, and also immune system. Maybe we'll see something on immune system later on in the other slides. And we are saying the complementary feeding should start 6 months after. And we are saying when you start 6 months after exclusive breastfeeding, you are preventing the child deaths and also the undernutrition. And therefore, complementary foods are the nutritious foods that are given to child after 6 months together with breastfeeding. That's according to the WHO. And today's, we will not be dealing with weaning, and rather we are going to do complementary feeding. Weaning is a past term that were referred by our fathers, our mothers a long time ago, and now we are on complementary feeding. When we talk about complementary feeding, we are saying other than breastfeeding, we are introducing other foods, solid foods to these children. Remember, these solid foods, we have a way on how you can introduce it, and that is what we are going to see them later on, alongside breastfeeding. Unless otherwise, when the mother is not there, due to medical condition, due to natural effect, that may be death, and due to many other factors that may not require the mother to breastfeed, that's now the time we will do complementary feeding purely without breastfeeding. And some studies have shown that complementary feeding in India, 6 to 8 months, children are According to some studies, complementary feeding is not initiated in more than half of infants 6 to 8 months in India. Those are some studies that it had shown that India are a little bit behind in starting or initiating complementary feeding among the children of the same age. Actually, what are we aiming in providing complementary feeds? We are saying we encourage mothers to do breastfeeding, which is exclusively nothing but breast milk, nothing but breast milk. Those mothers are able, unless we empower them. That's now the time they will be able to breastfeed exclusively. Early introduction of complementary foods has a negative effect to the children. And therefore, we are saying we need to introduce complementary feeds after 6 months. And also, we encourage these mothers to continue breastfeeding up to 2 years and beyond. Infants, a mother can feed the infants, or other older children can feed these children, these infants. And therefore, we are saying we need to make sure that it's an inclusive process where each and every member of the family is involved in feeding these children. And when you feed these children, if the responsibility that is posed to allow other family members to help these infants feeding is to show warmth, to show love, and also to assure that these children that this food are okay. And therefore, we are encouraging these children to feed these infants slowly and be patiently. We call it cautious feeding, and not to feed this child. So we encourage by even talking to these children, to this infant, by giving them maybe songs, by encouraging them slowly and being much patiently. And also the type of food that we are introducing this is we start with different food combination which have different tastes, textures, and also we have a way on how you encourage these young children to feed. You cannot feed your child while watching, or rather you cannot feed your child while you are on a WhatsApp, or you are on email, or you are conducting your online classes. Time for a child to feed is the time for that child to be fed. And therefore, I'm saying that we need to be patient as we encourage these children to feed. And therefore, that is by minimizing disruption during meals. You switch off your TV, you switch off your phone, you switch off your computers so that you feed. We are saying time to eat is very, very important, and we need to respect that time. Because these children learn from what we are doing. If you are watching and eating. Those children will not allow you to feed, to eat when the TV is switched off. And therefore, I'm saying that we need to switch off all the distractors and maintain the eye contact while feeding your infant. The kind of food that you are feeding this child should be safe, stored in a clean environment. It's actually the principle of hygiene. Whoever you leave your child with should wash his hands, the hands of the baby, because also we are encouraging this baby to feed his or herself. It's a learning process. The storage of the food should also be safe after preparation. And also when there is leftovers, you also need to keep them safe. The utensils also should be clean. Cups and bowls should also be clean. and avoid bottles, teats, and pacifiers. I think the Act is very clear about teats and pacifiers. Pacifiers are not good. They soothe the child to sleep and minimize distraction or disturbances. And by using those pacifiers, it affects the saliva, which acts as the first defense of the infant. It keeps the mouth warm and moist, and also it has some enzymes, which also destroy some bacteria. So let's avoid pacifiers. Feeding bottles also, we are not able to clean the teeth of the feeding bottle. For instance, why am I saying this is you at all times you'll not be there with your child. Your child, you leave your child with other family members whom they will take care of. And for instance, those family members, when they are, if they are young, below 18 or 20 years of age, they will be concentrating on other things. They will not be keen. They will not be patient. They will be trying to make sure that the baby feeds very well, very fast, so that they engage on other activities, maybe on WhatsApp, maybe on Facebook, maybe on Snapchat. And through that, you'll not be able to control them. And also hygiene-wise. The amount of complementary feeds, I've stated clearly here that it should provide at least 200 kilocalories per day. This is when we talk about kilocalories, it's actually the amount of energy that patient, that baby requires. That is after 6 months to 8 months, you should provide 200 kilocalories. Remember, we are trading this to the tropic food. The kidneys are not yet ready to handle this food, the wastes from this. The body is not able to the high levels of potassium, in terms of sodium. So we are training the metabolism. The process so slow. Infants, some of them get bloating, some of them get constipated because we are giving too much of the nutrients. And then again, we have also the waste in terms of urea. The kidneys cannot handle the high levels of waste, and therefore we are giving the low amount of calories, which is equivalent to, depending on how the formulation, it will be slighter than maybe 300 ml or 400 ml of the formulation, which will give you 200 kilocalories. Then 9 to 11 months, we are increasing them gradually to 300 kilocalories, then 550 kilocalories per day from 1 year and above. Remember, this child from 9 years, the activity level also goes up. The baby is also growing, is also learning, is also the movement, the mobility is very, very high. Food consistency gradually increase. Actually, when you're starting the complementary feeds, you start with the thin, then you go to thick. The thin are the foods which, when you pour, it will form a rope-like string. And we are saying that you don't need to give thick foods, but you start with thin as you graduate slowly. This food should be pureed, should be mashed, and then semi-solid foods begin after that 6 months. The observation that I've made is most mothers prefer using blender to make infant foods, or rather pureed foods. These blenderized foods, it's okay. You can give your child blenderized or pureed foods, but you need to move slowly. By slowly, you give mashed, then you go to semi-solids. Why are we doing that gradually? is so that they can stimulate the chewing and also the suckling, the chewing and the swallowing, sorry, of this child. Most of the children who depend on blenderized food or pureed food will not be able to swallow the semi-solid foods. And therefore, we are saying we need to improve on the consistency from pureed, go to mashed, then semi-solid foods. You can give some solids like pawpaw, you can chop slowly, small pieces. If it is a piece of ugali, you can chop small pieces, which are able to be swallowed by the infant. At 8 months, the baby is can able to lick the finger. They are able to dip their fingers on the foods and try to lick the fingers. And we are saying that you need, at some point, you need to encourage them. You don't need to abuse them, or you don't need to shout on them, but that's a learning process. And we are saying, do not give your children nodules, whole milk, or deep fried foods. We are going to see all this later on, but just a snapshot of nodules. You don't know even what these nodules are being prepared for. It's high in salts, it's high in preservatives, like they use monosodium glutamate, which are chemicals. And remember, your child's system is not ready to handle all this. Whole milk contain between 3.0 to 3.5 to 3.8 grams of fat, which will not be digested by the baby will be struggling digesting the fat, and it will affect the enzymes. Some of them will strain the liver enzymes, and you may find that your baby may diarrhea. And the loose motion is actually maybe fatty stools because they skip the digestion. Deep fried food also has a lot of fat. And I encourage mothers, if at any point in life, maybe after 1 year, 11 to 1 year, or and above, if you want to buy your child deep fried foods, please cook for yourself. Because the kind of fat that we are using outside here is very, 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 very bad. You can imagine somewhere the cooking fat is recycled. The color of the cooking fat should be golden, but now you find that wherever they are doing deep fried foods, you find the fat is black, which is not actually good for our systems. And for us who have a very sensitive stomach, they may have diarrhea, they may have other food reaction and allergies because of that fat. And we are saying by 1 year, your child is able to consume the rest of the food. You cook the food, then you give the child his own food, then you feed with that one. And make sure that you stay away from destructive environment so that you can prevent choking. You can imagine your child is with a caregiver who doesn't know how to perform a first aid for someone who is choked, and your child is being loaded with a solid food that has choked, and it has lodged on the trachea. That is now another issue. So we need to maintain the consistency and also to avoid destruction, as we had said earlier. We also to avoid nuts, grapes, and raw carrots. Nuts are very high in citric acid. Also some grapes, the baby can swallow. They are small, they can swallow. And also the raw cabbage, as much as raw carrots, as much as we are saying carrots is a source of vitamin A. But this vitamin A cannot be utilized by the body if it doesn't have fat. We have the kind of fat, we call it chylomicron, which binds with vitamin A, that is the beta carotene, and it is transported to hepatic portal circulation. So when there is no fat, I'm very sure there is no utilization of vitamin A. And also we are saying prevent disruption and interference, which we had talked earlier on. Next slide. Meal frequency and energy density. Increase the number of times that the child is feeding as it gets older. We are starting with 200 kilocalories. We are going to 300 kilocalories. Then we may move to 550 kilocalories. The rationale for this is actually because of the increased energy requirement, increased body surface area compared to volume ratio, and also the activity level of the child is increasing. So the number of feeding depends on the energy density of the local foods that are usual amounts consumed at each feeding. So if a baby is consuming ugali, for example, ugali, you may find that the volume of ugali as compared to the volume of maybe porridge will be different because of the energy density and also the amount of the food that is being prepared, especially on uji, you're using water, the amount of flour that you are using is low compared to what you are using in ugali. And we are saying 2 to 3 times per day at 7 months to 8 months. You are increasing it gradually, then 3 to 4 times per day, 9 to 10 and 12 to 24 months, you give your baby on demand. The 2 to 3 times, remember you are starting complementary feeds. You are training the system of the baby, and therefore you don't need to give too much of the food so that we can prevent constipation and bloating. We also need to give, in additional to 2 to 3 times, you also need to give nutritious snacks. In this case, maybe fruit. And the kind of fruit that we can give is maybe a banana. We can give pawpaw. We can give watermelon, minor seeds. You can give also the orange. So that this child can have stores for zinc, molybdenum, and also cobalt. Those are nutrients that control appetite, especially zinc in infants. Very high levels of zinc, your child will not refuse to eat. They will have good appetite all through, and you'll not be struggling forcing your child to feed. If energy density of or amount of food per meal is low, the child is not breastfeeding, you need to increase the frequency. For example, if you are giving uji, if it's thin, you can increase the quantity because also there is a beneficial effect when you start your child with uji or porridge. The better amount of uji is water, which helps to hydrate the baby. And therefore, when your baby is not taking water, they can get from the porridge. And we are also requesting mothers to feed the child on demand. You don't say that your child has slept, so you don't need to feed. You need to wake up the child so that you feed your child. You feed on demand. If you leave your child to sleep so that you can get more time to do other things, you are not doing justice to your child. And therefore, we are saying you need to feed on demand your child. don't do food rationing for your child, but rather give your child to food to the satisfaction. Next slide. This is the frequency, meal frequency table, which I got it from WHO 2000. Your child should take, and also the frequency, the texture, and also the quantities. I think I had explained about this, and we are saying if a child is not breastfeeding, complementary food should be given more frequently so that it compensates. If the baby is not breastfed, give additional of 1 to 2 cups of milk per day, 1 to 2 extra meals per day. So if it's not breastfed, you need to give 1 to 2 cups of milk. That's now after 1 year. The reason why we are discouraging the cow's milk or the processed milk, we are saying that the processed milk has high levels of preservatives, though the processing effects like the ultra high UHT, ultra high heater temperatures, and when you check, those are milk that can stay for between 90 and 180 days. If you check on how they are being preserved, is compared to the other one that we are keeping them on fridges. Those one, the microbes, we call it the vegetative microbes, are very low as compared to the others because they are heating up to a temperatures between 140 degrees to 150 degrees. Then they cool for 10 minutes, 10 seconds, then they do packaging. But the other one, they heat up to 72 degrees Celsius. They cannot kill microbes. They just kill vegetative sorry vegetative microbes, but they cannot kill them. They just suffocate them, and therefore when you keep on the room temperatures, they will start coming up. But for the UHT, it's heated up to degrees of 140 to 150 degrees. Then they cool for 5 seconds. Then they do packaging. Therefore, we don't recommend cow's milk. Then again, we have whole powdered milk. When talk about whole powdered milk, it has a full cream. It is homogenized. Homogenized in the sense that the breakdown of fat is passed through a perfusion where this fat makes a uniform solution with the milk. And the fat content is between 3.5 to 3.8, depending on the companies. And we are saying very high fat in these children will strain the liver enzymes. For those children who are ailing, those who are recovering, and those who are born maybe preterms or low birth weights, babies who cannot handle such things, the system is not ready to handle the same. And therefore, we are saying some babies can tolerate very well. I heard even a mother saying, my baby can take 500 ml. And I was saying, okay, can take 500 ml. When you see the baby is big, those are candidates for diabetes because the enzymes are strained, especially what we call insulin glucose receptor 1 will be affected, and therefore this baby will accumulate too much weight, and it's now a candidate for for diabetes. Another one is the too much weight gain will affect the milestones of the baby. The baby will not be able to crawl well. The baby will not be able to walk early. Why? Because children tend to accumulate more weight from the thighs upwards. And therefore, the legs will not be able to support the upper trunk. And therefore, that one will delay now this child from continuing developing milestones well. And some of them, we are saying them, they are failure to thrive, they are stunting, they are wasted because of such inappropriate complementary feeds. Next. I think this is a misplaced slide. Next. These are the nutrients. These are the foods that are required by your baby. Cereals. These are cereals. These are maize, flour. They are wheat. We have also tubers. These are warus, the cassava, the sweet potato, the Irish potatoes. We have also another, these are energy giving foods. Number one is energy giving foods. Second is bodybuilding foods. These are legumes and pulses, which are on classes of beans. We have vitamin A rich foods. These are fruits and vegetables. The dark green vegetables contain high levels of vitamin A. Also, those are fruits which are not orange in color are also rich in vitamin A. We have other fruits and vegetables. These are like courgettes. These are like cucumbers. We have also margarine. It's also vitamin A, vitamin D, vitamin E, vitamin K. Margarine is fortified. We have also eggs. Eggs is a high in protein. We have flesh foods. These are meat, fish, chicken, which are required by your baby. So from number 1 to number 7, your baby should at least take 4 of the 7 groups. You can either take, the first one is mandatory. So you can either take legumes from plant sources, proteins from plant sources, or proteins from animal source. You can also take vitamin A rich foods and vegetables. Then you opt for maybe the fruits, vegetables. You can opt for either any one of that, number 3 and number 4. Then number 6 also, these are proteins. You can also opt to interchange with the meats and also the other proteins. Why are we taking cereals with proteins? They complement each other. There are some nutrients which are in cereals and not in legumes. For example, lysine, an essential amino acid, is present in legumes and not present in cereals. Well, so in cereals, they have something called methionine, and this methionine is an essential amino acid, which you can just get from food. Remember, these essential amino acids you can take from food. If you don't take food, you cannot get this essential amino acid, and therefore, when you take them, they complement each other. What is in the cereal will complement what is not in the legumes, and what is in the legume will complement what is not in the cereals. And we are also saying that some of these children below after 6 months, the level of vitamin A is low, and that's why we need to encourage mothers. We need to encourage ourselves to take the green vegetables, and also part of it to have orange vegetables, orange in color, fruits, because of vitamin C, which has a protective effect on our bodies. Vitamin A also is very, very important because the level of vitamin A in breast milk goes down, and we are encouraging mothers to visit at 6 months. Your child should be in the clinic so that they can give vitamin A supplementation. Tea, coffee, sugary drinks are not allowed for these children because it affects the appetite. Your baby will want something that is sweet, 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 and therefore you will make your baby not tolerate other foods, but they will just be crying, 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 crying until when you give those sweet foods. Some of these, some of the fruits also has, for example, if you are taking animal protein, the level of iron also is very, very high. And I mentioned that we need to take fruits which are orange in color after taking your meals so that it will help in the absorption of iron. The iron status of the baby increases because of the increased volume, blood volume, and also increased needs in the body. And therefore, your baby, for example, you are giving your baby vegetables. The iron in vegetables cannot be absorbed if there is no vitamin A. But with flesh, the animal protein, it has something called meat factor, which helps in the absorption of iron. And this is recommendation by IAP to 2019. That is the latest citation, which actually says that you rather go for blended or chopped fruit juice. You just, at 6 months, you start with blended, then you go to chop so that you can train your baby to chew and swallow. Some mothers, because they are not patient with their children, they want to feed the baby very fast, the baby to sleep and go do other house chores. Wanazoesha watoto blended food. So when the baby grows up 1 year, they are not able to chew, and there you need to involve someone like occupational therapy to help us in stimulating the swallowing and the chewing reflexes. Am I audible enough as we go on? Next slide.
You're good.
So those are the foods that we need for this child. Iron supplementation.
Sorry.
Use of vitamin, minerals, and supplementation. These are for children who are at risk of malnutrition, or those children who are they are sick. Those whom maybe the levels of iron is low. So we do supplementation, that's iron supplementation. And some of these supplements, this iron, some of them, because of the high doses or high loads, they tend to cause diarrhea. But as the mother continues to use, the levels the baby will continue to tolerate. Vitamin D supplementation, the kind of houses that we are living in a mansionette where you are not able to get the sun, which helps to stimulate your kidneys to absorb calcium and also magnesium. And therefore, you see most of the children, around 65% of children who lives in a in a formal settlements, they have low levels of vitamin D or low levels of calcium because of the sun exposure. Some of them, also those children who have kidney issues, they need to be do supplementation. So when your child is sick, how do you feed? You just encourage feeding. If the mother is still breastfeeding, the mother is still there, you encourage breastfeeding. You encourage to take soft foods, and also you give varied types of food which are appetizing and also which are favorite. Children tend to take foods, they tend to be selective when they are sick. I remember when I was sick during my younger teenage age, I used to like soda and bread. So you provide your child with those foods which they like. Don't tell them no, soda is not good, or drink. Just to give something that is favorite. You make food that is colorful. It's not good to boil, just boil cabbage. You don't really even add tomatoes, which your baby will not like. After illness, remember when your baby is sick, the energy requirements goes up. That is to help fight infection. If the baby is on a medication, help also improve the action of the drugs, and also to maintain the needs, the requirements. And therefore the requirement slightly goes up. And when the baby is not being provided with enough nutrients, you tend to lose weight or either maintain the weight. But most of the children lose weight. And after illness, you need also to give food more often so that it compensates that food that was skipped by your baby during illness. So avoid giving fruit juices during illness because it worsens diarrhea and also it slows recovery. Most children who are sick, mothers think that when you give Ribena, when you give soda to your infant, they will love you more, they will cherish you, but no, they will increase the osmotic concentration of the intestines, which will worsen the diarrhea. So it's even better you give plain water. Avoid giving blood boosters during diarrhea for those who have sepsis differentials. Blood boosters will also is not allowed because it also worsens diarrhea. Next slide. When to start? We are saying that breast milk is sufficient to promote growth and development till 6 months. After 6 months, there is a gap between the total energy needs and the energy provided by breast milk. That is now the composition of breast milk and also calories, as illustrated by that figure 7.1. And therefore, we are saying the gap increases as the baby gets older. So the amount of iron the baby needs also increases. The amount of energy is also increasing. And also around this age, the infant behavior makes him ready for semi-solid foods. They're able to chew. And therefore, we are saying that you need to observe. Your baby is able to chew a little bit. Ukiweka kidole kwa mdomo yake, anajaribu kukutafunia. That is now the readiness of this baby to chew. And sometimes also you need to be patient with this baby because the baby is trying to learn how to chew. And therefore, sometimes they chew, then they relax. They chew, then they relax. they need more breaks, so because they get tired easily. So this table illustrates the age in months and also the energy that the baby is requiring at that particular age. We are saying you need to increase. The thing is, actually, you need to increase the amount of food, the amount of nutrients for this baby. Next. 6 months is the right age. Why 6 months is the right age? Because the infant tendency to push solids out of the food decreases. It encourages now the baby wants to eat. The baby shows interest in foods that you are taking. They're able to see you when you lift your spoon. They're able to see. And actually, I think the baby is trying to ask himself, what is these things that is being lifted? The baby is also able to hold the objects and put on the mouth. The baby is starting to move the food around the mouth with better control of the tongue. Teeth begin to erupt for biting, and also they're able to roll foods in the stomach. Also, the digestive system is mature, a little bit mature, not fully mature, but a little bit mature, and that's why we are starting small, but frequent foods. And also, the child is ready to eat soft and starchy foods. Care must be taken to ensure that these foods complement and not replace the breast milk. So you don't have an option of, no, I don't want to breastfeed my baby. Now that Daktari, I've said that the digestive system is mature, they're able to eat. No, it's not ready. And therefore, we do not need to replace the breast milk. We encourage breastfeeding up to 2 years and beyond for your child. And therefore, this is 6 months and above is the right age. Attributes of complementary foods. We need to observe time. That is after 6 months, you start complementary feeding. You need also to make sure that you give the adequate amount with different varieties and also maintaining the frequency. You need also to properly feed the baby with safe foods, which is prepared safely. It should have the right consistency, soft, prepared with easy to digest, inexpensive, locally available, culturally accepted ingredients, and easy to prepare at home. I don't know, I don't understand why mothers opt for these processed foods like Toto Afia, like vanilla, like baby weaning. I don't understand why, because when you see how this fly is being milled, number one, the fiber is removed, and then the inner plumule, where it has the oil seed, is removed so that they can prepare the cooking fat, the liando, the rina, and the fiber is used to make pig feeds. So you find that you are giving the jam, your baby, just the jam. There is no soluble fibers and also the fat. And today I'm encouraging you people, if possible, you can mill your maize flour. You mix your maize flour. At 6 months, you just use maize flour alone. You mill twice, the whole grain. You can also add millet or sorghum. Those are the 3 compatible. Anything outside those 3 classes is not good, because it falls on a different class. So let's use the maize flour the whole grain because of fiber, and fiber, the outer coat has B vitamins, which are very, very important for the metabolism, for the breakdown of the nutrients. And also it has the blue which has fat, contain vitamin A, vitamin E, vitamin D, which are actually a class of phytochemicals. We call them phytochemicals because it has vitamin A, D, E, and K, which are essential for your baby. Again, you can add the sugar. If you are preparing uji, you can add a little bit of sugar. Kwa umbali tu, so that the energy, you increase the energy. Don't use milk and milk products due to interference with the nutrient utilization. For instance, fiber, high fiber foods contain, we call it phytates, which affects absorption of calcium, absorption of iron. And therefore, we are saying that, I'm saying that we don't need to use milk. Some mothers say that milk contains iron, but the amount of iron that is in milk cannot be utilized by your body. It's very, very minimal, very, very low. With processed foods, I'm saying that have whole powdered milk as part of the ingredients. So processed foods contain powdered milk. We call them dried milk, which contain between 3.5 to 3.8 grams of fat, which affects the liver enzymes. It strains the baby systems to produce more liver enzymes. And it is low in B vitamins because the outer cover, that is the fiber, which contains B vitamins, is actually removed and used to make the pig's feet. So your baby will not benefit from fiber. And that's why you see babies get constipation, some gets bloating, some have a deficiency of B vitamins, especially B12 and B6, that is cyanocobalamin and pyridoxine, which are very, very essential in kidney functioning. And also, it's also very, very important in metabolism of vitamin K in the small intestines. So you can imagine your baby, number one, will have the liver enzymes will be strained, and also they will not be able to get enough nutrients in terms of micronutrients, that the B vitamins and also the water fat soluble vitamins. Next slide. Timely start. Complementary feeds should be introduced 6 months. I think that is what we have talked about, with continuous breastfeeding, when the energy, when need for energy and nutrients exceed what can be provided through exclusive breastfeeding. And therefore, that's now the need that your baby, you need to start timely. Don't wait until your baby is 7 months, 8 months, 9 months, you start complementary feeding. There is also a problem on the same. Introduction of complementary feeds before 6 months may decrease the intake of breast milk, making it difficult to meet the child nutritional needs and expose the child to risk of diarrhea and other infections at an early age. So those are the risks of early introduction of complementary feeds. Additional complementary feeds in formula-fed infants 4 months of age has been found to increase the risk of childhood obesity, which can lead to non-communicable disease, that's obesity, which occurs due to buffering effects of the insulin receptor 1, that is insulin glucose receptor 1, making lipogenesis faster than it should. Lipogenesis is actually the deposition of fats. We call it adiposits, which makes your baby to be too big. Adding complementary feeds too late. When you start too late, complementary feeds leads to suboptimal growth and development. Risks of nutritional deficiencies, failure to thrive, and also malnutrition. Those are now the effects of early introduction of complementary feeds and late introduction of complementary feeds. And we are saying you need to start the right time. When the baby is above 6 months, you start complementary feeds. That's 180 days and above. Next. Food consistency, that is what we had talked about in the, as I had illustrated in the table, that to provide more calories from smaller volumes, food must be thick in consistency. That's now after now your baby has adapted to the foods. That's around when the baby is now at 8 months, 9 months. Now you increase. Make sure that your food is thick. The first foods a child eats should be soft and homogeneous, should be mashed and strained, because now this baby is not used to semi-solid foods. So you need to start small, slowly by slowly, and should be milled twice to reduce depresses. Depresses, these are small particles that are found. When you mill your flour twice, you are improving on the consistency. And we are saying whole grain milling helps the baby to gather both minerals and vitamins in the flour. Different tastes should be gradually introduced with varying textures. Consistency of food should be appropriate to developmental readiness to child in munching, chewing, and swallowing. Your baby should be able to roll the food in the mouth as it chews, and also to swallow the bowls. We call it the bowls. When you train your child in that consistency of the food, they'll not have a problem in swallowing or chewing. Food which can cause choking hazards are to be avoided, like now the nuts. What I had actually described earlier on, those small foods which your baby can swallow and choke the baby should be avoided. Gradually, food consistency, amount, and variety are increased with age. Introduce lumpy or granular foods by 9 to 10 months. Small chopped pieces of food can also be mixed so that the baby can pick. Give finger foods between 9. So these are foods that when your baby can dip on the fingers inside the food and also lick the fingers. So all grain foods are very, very important because of vitamins and also minerals. The above is an illustration. The first one is just the right. That's now the thick, but the other one is too thin. Ukimwaka hivi unaona ni kama uzi. As you start with the too thin, then you go now to the thick. You can demonstrate that one in your, when you put on your plate, it's able to, inaweza mwakika. It takes, ikianguka hivi itakuwa imemwakika yote. That's now thin, too thin. But the other one, when it topbles down, it cannot pour down. And this is the source from WHO, complementary feeding chart. Next. So again, dietary diversification is very, very important. And should be minimum, not maximum. So we are saying that your baby should consume 4 or more food groups from 7 food groups to meet the daily energy and nutrients requirement. Usimpatie tu mtoto uji. Don't give your baby just porridge. You give porridge only. That baby will suffer from kwashiorkor. When you give protein, just protein, you'll be straining the kidneys. And therefore, you need to balance. You need also to give, when you're giving like vegetables, like you start with the spinach. You just use a pistol and a mortar. You crush until it's now very soft for that baby to swallow. And this ensures that the child has the high likelihood of consuming at least one animal protein source, and also a fruit or a vegetables a day. So we are saying fruits helps the baby to improve the appetite by doing what? By improving the zinc, the magnesium, the molybdenum, and also the cobalt levels. In addition to the staple foods, that's a grain, that's for energy. Root also is for energy. Tubers is also for energy. But again, your baby will also benefit from some minerals like potassium, phosphorus, which is very, very important in bone formation. Provide your child with provide your children with a diverse range of food to ensure fulfillment of their micronutrient requirements, including the need of vitamin A, iron, calcium, thiamine, folate, zinc, vitamin B6, that's pyridoxine, and also B12, that's cyanocobalamin, which we had actually talked earlier on about vitamin A, the importance of vitamin A, maintenance of epithelial tissues of the gut, immunity. And your baby can, if you tell someone to take carrots, wash your carrots and take, that person will not benefit from vitamin A. For vitamin A to be utilized, or rather absorbed by your body, it requires fat. For iron to be absorbed in your body, it requires vitamin C. Unlike in meat has something called meat factor, which I talked about earlier on, which helps in absorption of iron. Calcium, thiamine. If you take foods, mixed foods, which has phytates, it will also affect the calcium, absorption of calcium. Thiamine important for metabolism. Folate, very, very important for maintenance and also growth of fatty tissues, and also the blood. Also zinc, immunity, B12 and B6 are very, very also important. Next. Iron gap. This is now an illustration of the amount of iron in breast milk, the iron requirements, the iron in breast milk, and the iron stores in the babies and also in the breast milk, and also the iron gap that the baby requires. And we are saying the more when the baby grows older, the amount of iron requirements goes up. But now with the kind of food that you are providing, you need to make sure that you provide foods which is also have iron in it, like the liver. You provide the liver with your baby, maini. You can just chop small pieces. You give your baby to chew. You can also provide your baby with the green vegetables, which has also iron. Then after taking the green vegetables, you give it fruits which are rich in vitamin C and also vitamin A for it to be absorbed in the system. That's just a summary of that, the requirement. We are saying full infants are born with inadequate iron source and get some iron in breast milk. Thus, do not require additional iron for the first 6 months because the iron levels in breast milk is also high. After 6 months, the iron levels goes down, and therefore your baby is now dependent on the food that you are giving, and therefore you need to provide food that are rich in iron after 6 months. Some babies need supplementation. You give blood boosters. You give foods that are rich in an iron. Those are legumes, dried foods, meat, fish, and also the poultry. The important about fish is because of omega-3, which is also a protective omega-3, omega-6 fatty acids, which is very, very, very important. Next. Foods to be avoided in infants. Tea and coffee. It interferes with iron absorption. It interlocks with the tea contain tannins, which blocks absorption of iron. Coffee contains caffeine, which blocks also absorption of iron. And tannins and caffeine are known to increase our concentration time. And that's why when you take tea, you are not able to get sleep faster. It interferes with your sleep. It also interferes with, it makes you to concentrate more. And also it affects your iron stores. So those infants, we don't encourage them to take tea or coffee. Aerated vegetables, no nutritional value. It has flavorants, which actually improves the taste. But the nutritional value, there is no. And again, it has also preservatives like monosodium glutamate, which improves the shelf life, which are not good. Too much sugary foods and fruits causes decreased appetite for the nutritious food, and also may cause loose stool. Nuts may cause choking, especially if you are not patient with your child. Commercial complementary foods associated with the lower intake of fruits and vegetables. Also, too much sugary foods and drinks also increases because of high glycemic index. It also affects the satiety and the urge to take more food. Ultra-processed foods and commercial snacks, foods such as biscuits, cookies, candies, chips, savory snacks, which are greasily advertised, are rich in sugar, salt, and fat, which affects your baby. Find that your baby is gaining too much weight. Ukienda clinic, no one will tell you your baby is growing underweight, but they will tell you your baby is growing good, not knowing that you are preparing yourself for non-communicable diseases, diabetes, hypertension, and also some types of cancers. So we need to avoid these foods when you're feeding our infants. So what are we talking? We are saying that apart from breakfast, lunch, supper, you need also to give your baby snacks and nutritious snacks, which are very, very important, so that they can improve the energy requirements for this baby. This baby requires more energy for growth and development, and also the activity. And the 3 main meals, they are not adequate. You need to give an additional 3 snacks. Snacks at 10 midday, snacks in the evening, mid-evening, and also before they sleep, you give another snack, and should be healthy snack. The snack should not be sugary things that you are giving, should not be nodules, should not be popcorns that you are giving these children, because they don't have nutritional value. They are not good. They are not they are not sustainable in terms of provision of nutrients. And those snacks should not replace the foods. They should not be confused with foods such as sweets, chips, or other processed foods, junk foods, ready-made foods, processed foods from the market, e.g. tinned, isozote. You don't need them. Giving drinks with low nutritional value such as tea, coffee should not be allowed. So you need to give a health and nutrition snack. This health and nutrition snack can be banana, can be uji, or it can be mashed foods, mashed light foods. Next. Responsive feeding. With responsive feeding, we are saying that you need to feed your child when it's awake, when the baby is jovial, you don't feed your baby when it's crying. You don't eat your baby forcing them to eat. The responsive feeding is being patient. You maintain the eye contact of the baby. You observe your baby, how he's swallowing, how he's chewing, and all those. You encourage the baby to feed. And we are saying you need to smile and maintain the eye contact. You need also to talk to your baby. You feed slowly, and you give different food, different textures. And also you need to minimize disruption. Next. That is responsive. That's pure responsive feeding. Next slide. This is a father, or rather the person who has been left to feed the child. You see that the baby is happy. That's now responsive feeding. Next. Add one complementary food at a time in small quantities. This is followed by introduction of the second complementary feed. The reason why you are doing that is so that you can observe which food the baby is reacting to, so that you can eliminate, you can stop that one. Then you feed slowly and patiently. That's what we have talked about. Don't force your baby, or piping your baby should be avoided. You don't threaten your baby or punish, because it interferes with development of the good. As the baby grows, you need to encourage them to feed by themselves again, using a cup and also a spoon. Then you encourage your baby actively by appraising them, and also to encourage those foods which they are happy, and those foods which are not happy, that you know that they are healthy and also they are nutritious. The next. Hygiene, very, very important. We have talked about this hygiene, that we need to, the caregiver need to take utmost practice to ensure that the hygiene is maintained, and also to avoid bottles and thieves. So hygiene related to complementary feeding, very, very important. Very, very important. And this one you need to engage. You need to engage the person who is taking care of the child. Then next slide. National guidelines on infant and young child feeding. That is what we had actually talked. This is actually a repetition of it. The recommendation is early breastfeeding, early initiation of breastfeeding. Then we encourage mothers to do exclusive breastfeeding. Then optimal complementary feeding, which is should be adequate and also should be timely. 180 to start at after 180 days, so that to meet their evolving nutritional requirements. So early initiation of breastfeeding will prevent dehydration, will prevent issues to do with kidneys of this infant. And also it will help the mother to produce enough milk. That's, we call it lactation, improve lactation. Next. So you need to encourage the mothers to continue breastfeeding 2 years and beyond. Expectant mothers should also be motivated and prepared early enough. This is where we are now missing. Mothers should be encouraged early on breastfeeding and prepare them on breastfeeding, exclusive breastfeeding, and also continuous breastfeeding. We need to empower them so that they know that they are able to breastfeed. They'll be able to breastfeed exclusively for 6 months and also continue breastfeeding. That is a reassurance. We need to tell them that we need to give your baby at least four food groups. That's the food grain, tubers, legumes. Among all those, should get at least from 3 main groups, 3 main food groups, and should be fed 2 times should be fed frequently as they breastfeed. Also, active feeding for children during and after illness. They need to be empower them so that they know that even when the child is sick, they need to continue breastfeeding. Next. So we are saying complementary food should be balanced. At least 8 to 10% of the energy should be obtained from proteins of good quality. Should be prepared from cereals. Those are what we have talked about in class 1, the protein, the carbohydrates, and also the protein, energy giving food, the protein that is bodybuilding food, and also the protective food that are now fruits and vegetables. We had talked about the lysine, which is the essential amino acids, and also the methionine, which is essential amino acids in cereals. I think these are just a repetition of what we had talked earlier on. We say oil and fats and sugars increases dietary energy levels and improve tastes of the food. Additional of vegetables and fruits will further provide minerals such as iron and vitamins. I think that's now a repetition of what we had talked earlier on. Next. Tips for improving quality of food. Complementary food should contain cereal pulses, combination. That is what we have talked about. We also need to soak germination, soaking, germination, sprouting of cereals and pulses improve the nutritional. Improve the nutritional. We say when you do that, you are breaking down, you are making the nutrients more available, and the baby cannot use more energy to break down. Also, it reduces the levels of phytates in these foods, which will affect the absorption and absorption of calcium and also some iron. And also, we need to use locally available fruits and also foods which are locally available. You don't need to go for something that is expensive or something that is being imported. Something that is available, we need to utilize it. Then next, age-wise complementary food, start, mashed. That is what we had talked about easily. I think I had expounded this in the earlier on. We also iron fortified foods, iodized salt, vitamin A enriched foods are to be encouraged. Soup of puree of dark green vegetables are a good source of iron in infant and should be added. Fruits and vegetables will further enhance the nutritional quality of foods. I think those are what we had actually talked earlier. This table, feeding practices, ideal, feeding practices, key messages to counsel mothers. This is actually what we have talked about cautious feeding and also the kind of food that we need to feed in terms of textures. I think it's a continuation. Next, assessing the practices of complementary feeding and counsel on ideal feeding practices. This is what we have talked about. The child, about the frequency of feeds, and also what are foods that we need to give these children. Next. Counseling and educating mothers on complementary feeds. We need during clinics. This is what we are doing. About also the consistency of various foods. Those are the key messages that we are giving these mothers, including even how to prepare these foods in terms of soaking, in terms of pre-cooking, in terms of sprouting. How important is it? Yeah. So next, I think the last slide before thank you, the last one. We have things like Weetabix. Weetabix are very high in fiber. I think it's not there. Weetabix is very high in fiber, which lowers the glycemic index, hence lowers the baby's cues, leading to inadequate food intake as a result of reduced frequency of food. So you don't need to give your child Weetabix. You don't need to give your child deep fried foods. You don't need to give your child the highly processed food because it's nutrients deficient. Thank you so much. I think from there.
Sorry. Thank you so much, Kimbwe. That was a fantastic presentation, very clear, very concise. We have a few questions. If you could answer for us, maybe we can take maybe another 3-4 minutes just to answer. So we have the first one, like, how do we do exclusive breastfeeding in an era where the workplace doesn't support maternity leave? By 6 weeks or even less, a woman is back to work, contributing to decreased breast milk production. I don't know if you got that, Kim. Where did you? Kimboy? Mr. Kimboy, are you with us?
Yes, Daktari. Oh, I'm sorry.
I was asking, we're just answering a few questions here.
Yes.
Wanted your input. So the first one, as I said, someone is talking about exclusive breastfeeding in an era where the workplace doesn't support maternity leave. Okay, she basically says it's contributing to decreased breast milk production.
Yes.
So how best can we try and tackle that? I know this one.
Number one, we have workplace support, which is it's actually an act that requires that employers to establish a workplace support. In Kenyatta, for instance, we have a workplace support for staffs. We have two. We have one in private wing, and we have one in the general ward, which is placed in next to all the building. So, and therefore.
Hello?
The regulation states that we need to have 3 months of maternity leave, and further even 2 weeks, 2 weeks of paternity leave. So I think it's a regulation, but so some employers don't adhere to them, but they need to be sensitized on the same. Daktari.
Okay. So maybe I'll just combine maybe two we see. So the next one is, should the food be safe for those who don't use the blender? And how can I measure to know that my baby does not exceed the said measurements of calories?
We have we are saying when you start with at least 2 to 3 tablespoons. That's around 45 ml. Then you increase gradually. You observe your baby cues. If the baby needs more, you just increase. But suddenly you also need to check the baby, whether it's getting too much or too little. But you need to measure using your cup, the baby's cup. It's always, it's better you calibrate it. You see, this is a half, this is 3/4, so that when you give, like you are giving 7, 8 months, 8 months should have take around 150 ml per feed. Then as it grows, it continues to 3/4. Then at 9 months, should be taking like a whole cup of 250 ml per sitting. That's how you understand. And also you need to observe your baby, how he's taking. So I think I never answered the first question about decreased milk production. You need to have something like a marmalade or some other breast milk enhancers, which will help you to maintain lactation.
Maybe while we're here, I could ask, what is your take on fenugreek and dill seeds? The things we are told to drink to increase milk production?
You need to reduce pureed food, just the warm foods, the porridge, the what do we call this? The soya, the chocolate. Those are some of the foods that helps to maintain lactation. And during night, you don't need even to take ugali. During night, like at 12 midnight, you don't need to take those ugali, but you can take just like milk plus maybe a snack, a bread, something that is warm. You can also reserve some warm water. You prepare chocolate. That will boost breast milk production. Then enough sleep. You need to be out of stress. But because when you have stress, it affects milk production, and milk is in the brain. So when the brain is stressed, there is that decreased milk production.
Okay. We have another one. How can margarine be recommended for children? It contains high levels of trans fats, which has been linked to an increased risk of heart disease and inflammation. This is giving babies poison. I would recommend healthier alternatives like butter and olive oil.
Again, some mothers think that when they give baby something that is so expensive or margarine, they think that baby will laugh. But it's not good. I don't advocate for that, because the trans fats, those are precursors of non-communicable diseases. The baby will get overweight. The issues of diabetes will start cropping up. And therefore, let's use the locally available foods.
Okay. So another one is here. What can be given to a hemophilia? No, this is out of topic. What can be given to a hemophilia A boy, age 10, who's 22 kilos? He looks underweight. They've tried multivitamins and it's not working. He doesn't add weight. Is it safe for him to use Ensure? Unless maybe we can have our teaching on that later, yeah? Because we are starting a nutrition series.
Yeah. Yeah,
But
I
you
think
can just mention.
Hemophiliac babies need to have prescribed some supplements which are a little bit have the beneficial of iron in it. But you don't just prescribe something like some supplement which will make the baby just full but cannot have the benefits to the baby. For instance, if you are giving a baby like a mother, like something that is of beneficial, is something that will address that problem that baby has. If, like, for instance, a mother or a patient who has, or a baby who have diabetes,
Okay.
I think that is an independent case that needs to be
examined. I agree. So the next one is, what happens when a child is already overweight due to do you start complementary feeding at 6 months or delay? Then the other one is, what is the status of sweet beverage consumption among the under 5 in Kenya?
The state of?
The status of sweet beverage consumption among the under 5 in Kenya, that's one. And the second one is, do you delay a child who's already overweight? I don't know what that means. Do you delay starting complementary feeds at 6 months if the child is already overweight?
Irrespective of the age, we have those children whom they fall in, when you do an assessment, nutrition assessment, they fall in negative, positive 2 SD. The baby is too big for the age. That one needs to be examined independently and also needs counseling. And you don't need to delay complementary feed, but now you need to be guided on the quantity so that you control the baby from getting more weight. And the status of under 5s in consumption of beverage is very, very, very high, very, very high. In some studies were saying in every 3 children out of 5, when they go to shop, they purchase the soft drinks. So you see now we are at higher end. That's around 55% of our children below 5 years consumes processed foods and also processed drinks.
Okay. We have another one. For how long is non-sustainable as an alternative to breastfeeding, especially in babies unable to get, mothers unable to get breast milk? Let's say or babies unable to get breast milk, e.g. if their mothers are deceased. And how does this lesson apply to HIV positive mothers who have to stop breastfeeding completely at 6 months?
For breastfeeding mothers, they need to, we have something called a fast criteria. A fast criteria means now that the mother will choose 2 options, either to breastfeed exclusively or to do replacement feeds. But now we need to assess the socioeconomic status of this mother, the purchasing power. Is this mother able to purchase this formula for 6 months? If they are able to do that, they can do that. If they are not able, they do exclusive breastfeeding. But now again, because of the stress, because of the environment, the way mother is, you may find that the breast milk will not be enough. This mother needs to be given something that will stimulate breast milk production. And then, if possible, you can do breast milk fortification, where you give you give this mother fortifiers so that they can enrich the breast milk to be energy dense. Daktari?
Okay. While I think we're in that topic, my question is, there are those instances where mothers have no milk at all, and
Yes.
they're from low social economic status, they can't afford the none. What do they do? Or what's the alternative?
You introduce early complementary feeding, but now you avoid those you avoid the whole milk, whole powdered milk, or the cow's milk because of this.
So what's the option? I don't know if we're still with you.
Yes.
Oh, I was asking, what's the
Yes.
option if you can't access powdered milk? Maybe you just have cow's milk and the baby can't starve. What happens?
I was saying that for those mothers, you encourage if they start complementary feeding, you don't encourage them to use whole milk or cow's milk. They can start with pureed uji or porridge. You can also you can modify these cereals. You do sprouting, you do a little bit of fermentation so that to improve the digestibility of it. But the use of cow's milk, that one is not allowed.
Okay.
Yes.
Then what's your recommendation nutrition-wise for children under 6 months with iron deficiency anemia?
Some
Of note with anemia and iron.
children who are below 6 years with low iron levels, first you need to assess this child. Why is it? Most of these children which have low iron levels are preterms, those who are delivered maybe because of hypertensive crisis in the mothers, those who have uncontrolled diabetes. But that one now needs an intervention of a multidisciplinary. But on the side of nutrition, you encourage foods that is high in iron and also those which helps to absorb iron.
Okay, it's an interesting one. If you talk of complementary at 6 months, you mean at the start of 6 months or at the end? Please clarify using days, exact time to start.
After 6 months. That is after 6 months.
After 180 days.
Yes.
So day 181.
Yes.
Okay. And they ask, which food do you advise them to start with at that 181? Day 181.
They can start with milled whole grain maize flour, pureed or sieved. Then after around 20 days, you start mixing. Now you mix maize and also the millet or the sorghum. Then you continue with the millet and mixture of millet and sorghum, maybe in the ratio of 1:1.
Okay, so this one I'm just adding. Weetabix, okay, and Weetabix plays I think they got the source from Google, plays a beneficial role in children's diets, particularly as a breakfast cereal. It is a good source of fiber, low in sugar, and provides essential vitamins and minerals like iron, folate, and zinc, which can support children's growth and development. Additionally, it can contribute to healthy digestion and energy levels. So they are asking, does it mean Weetabix is good if given in moderation?
Weetabix is very high in, I agree, it's very high in fiber, but that fiber will form the larger bulk. And remember, this child, the energy requirements is very high, and the baby's cues are controlled because of by these fibers. So it affects the baby's cues, which will lead to inadequate dietary intake. Why? Is because the low in sugar and high in fiber, the glycemic index, the sugar that enters into the blood, is controlled. And therefore, the baby will not feel hungry all the time. And then again, that activity of the baby requires to be feeding more, but frequency. So when you give Weetabix, yes, it has minerals and it's fortified with minerals and vitamins. But again, the glycemic index is very low, and it will affect the frequency of feeding this baby. You may find that the baby will go maybe from morning up to in the afternoon so that they can feel hungry. But when you give food that has moderate fiber, this baby will feel hungry very fast, and the frequency of feeding will be higher. Unless for isolated cases, for babies who are maybe overweight, those on whom you want to control weight, patients or children who are diabetic, who have diabetic type 1, that's now the issues of Weetabix can come in, but needs to be assessed.
Okay. Kibo, I think this has been such an amazing talk, and probably we might organize for another nutrition CME very soon. We're very grateful for your contribution. Any last words?
What I need to, the last shot is what you feed your baby determines the future of that baby. If you feed your baby with the local, just the normal food, which are deficient in nutrients, omega-3, which helps in brain functioning, brain development, maintaining the IQ of the baby, it's now up to you to decide which kind of food to feed your baby. Then you need to, when you visit to the clinic, please make sure that you see the nutritionist so that they can advise you appropriately on the dieting, on the quantity, and also the variety aspect of it, depending on your child weight for height and weight for age. And for any consultation, they can reach to me through you, Daktari.
Okay. Thank you everyone for joining us today, and we'll notify you of our next one. We hope you've learned a lot. Have a lovely evening.
Thank you, Daktari. Also have
Thank
a lively evening. Thanks for your time for moderating.
you.
I don't take it for granted. It has been an amazing webinar.
Okay, it has. Thank you.
All right.
All right, good night, everyone.